Good afternoon. Hi, everybody. Thank you so much all for joining us. My name is Leverett Wing. I am the Executive Director of the Commonwealth Seminar, and I am very excited that the seminar is co-hosting this Lunch and Learn with the All of Us Research Program at Boston Medical Center and with Partners Healthcare. Before we get too far into the program, I wanted to let you know a couple of housekeeping items. This Zoom is being recorded. So if you'd like to turn off your screen or change your name in your ID box, please feel free to do that right now. Also, a list of resources discussed here today will be sent by email after the program. So while we encourage all of you to take notes, please know that you'll be able to access whatever's discussed here after we're finished. So please don't miss anything, just in the sake of taking notes. A page of resources, especially for underserved communities and especially for communities of color, will also be provided after on our resource page. And if you're here representing an organization or would like any resources available for others, please leave your name of your organization and your contact information in the chat box. That way we can all network a little bit. I know usually we have these lunch and learns together and we're able to see each other personally, but it's a little bit different now. So please leave your organizational name and whatever contact info you'd like in the chat box. I guess if you'd like to start recording now, Cheryl, let's go for it. As I mentioned, my name is Leverett Wing, and I'm the Executive Director of the Commonwealth Seminar. For the last 15 years, the seminar's mission has been to open the doors of government to everyone. And to that end, we work with leaders and activists from underserved communities and communities of color to teach folks about the ins and outs of government, the legislative process, the budget process, lobbying and advocacy, working with the press and media, helping our communities develop the tools they need to access decision makers on the state, local, and national levels. And let's be frank, being able to access these leaders and the resources of government has rarely been more important than it is now, or vital as it is now. Having our voices and perspectives heard has rarely been more important than during this pivotal time. It's literally life and death for our communities. Our physical, economic, and mental health are at risk. And we're grateful to have this opportunity to partner with the All of Us program and partners to offer this lunch and learn about mental health, which is too often ignored or underreported in our communities. So I'd like to thank two people in particular at the All of Us program at Boston Medical Center for all of their hard work in making this possible. Elizabeth Antonellis and Cheryl McLeod. Cheryl is a seminar grad and she is a force of nature. She was the catalyst for this. And Elizabeth has been fantastic to work with and has been instrumental in making this event happen. So if you want to use that little wave function on your Zoom thing, which I still can never figure out, please feel free to do that. The All of Us program, just so you all know a little bit of background, the All of Us program is a historic research effort which aims to enroll over 1 million diverse volunteers across the United States who are willing to share their health information for medical research that will lead to better, more personalized treatments, especially among communities of color. So we encourage all of you to learn more about this incredible program and sign up if you can. All of Us actually created and customize this lunch and learn for the Commonwealth Seminar, initially for COVID-19, when we came together about a month and a half ago. But clearly that dynamic has changed with the recent killings of Ahmaud Arbery and George Floyd. And just when you thought things couldn't get any more stressful in our community, they did. And we realized that although the causes of stress may be different and the levels of stress may be different, the damaging effects of stress on our communities and the effect it has on our mental and thereby physical health is universal. So we're grateful because when all of us saw this change in dynamic and they saw the need for our communities to have this discussion on mental health on a broader scale in light of the additional events of the past few weeks, they opened it up to the wider community. And so we are so grateful for the generosity of the All of Us program, and we really are looking forward to working with you in the future. This is hopefully just the first of many partnerships with the All of Us program. And given that there are, what, over 125, 130 of us registered, I think the demand is definitely there. So thank you, all of us. And so we're going to now turn it over to a couple of our incredible speakers. It was an absolute coup to get these two speakers, and I was really excited that they are here. Before we get to them, just to let you know, some of the questions that the initial questions that I'll be offering were submitted in advance before the last couple of weeks by folks from the Commonwealth Seminar family, and then when we opened it up to the larger community, a few more questions opened up. But we will present more questions and be taking more questions at the end. You can ask your questions in both English and Spanish. You can send your questions privately to Cheryl in English and Elizabeth in English and Spanish. And I'm an optimist, but even I know that there's no way that we're going to get to everybody's questions and answer every single question that you all have. So any questions that are not answered personally during this Q&A session will be posted. We'll have the answers posted on the Commonwealth Seminar website in a few days, hopefully. So. Thank you so much all for joining us. I am excited to introduce Dr. Jordan Smoller and Luana Marques. Dr. Smoller, I get to call him Jordan, which is even more exciting. Dr. Smoller is a professor of psychiatry at Mass General Hospital. He's a professor of epidemiology at the Harvard T.H. Chan School of Public Health. He's the principal investigator in the All of Us research program. His research focus has been on understanding the genetic and environmental determinants of psychiatric disorders across the lifespan, and using big data to advance precision mental health, including improved methods to reduce risk and enhance resilience. So as a data guy myself, I love that. Dr. Marques is an associate professor of psychiatry at Harvard Medical School. She's the director of community psychiatry program for research and implementation and dissemination of evidence-based treatments, otherwise known as PRIDE. Thank goodness there's that acronym, PRIDE. And she's the associate director of the Center for Anxiety and Traumatic Stress Disorders and Complicated Grief, also known as CAT-SD at Mass General Hospital. Dr. Marques's major clinical and research interests include implementation of evidence-based practices for individuals suffering from a variety of behavioral health disorders in diverse communities. And we are so grateful that they are both here today to offer their perspectives. Thank you both so much for your time and your generosity and your flexibility. So I'll turn it over to both of you and look forward to hearing what you both have to say. Thank you so much.
Thank you so much, Leverett. I want to thank you, and I want to thank the Commonwealth Seminar for inviting us to join today. I also want to thank just everybody who has turned out today and taken the time to be here amidst all of the unbelievable challenges that everyone is facing in their lives right now. I think the interest in this topic, as you said, so many people have signed up, really just speaks to the extraordinary time that we are living through right now. There is a lot of pain, a lot of anguish and anxiety that so many people are feeling, and especially right now, as you mentioned, in the Black community. When we first planned this seminar, as you mentioned, we were really reeling from the devastation and anguish that our communities were facing as a result of the COVID-19 pandemic. And as with many things, that devastation has been disproportionately borne by communities of color. And now we face another crisis in the wake of the murder of George Floyd and the killings and suffering that so many have endured before him as a result of systemic racism. And so the issue of mental health is, I think, even more on our minds at this moment than it has been in recent memory. So I'm grateful we can all come together to talk about this. And as you said, I think there's obviously more than we can adequately address in an hour, but I do hope that we can provide some useful information and address at least some of your questions and leave here today with a sense of what we can and need to do to get through this time together and to provide hope for the future. I know that Luana, I'm going to say a few words first. I'm going to turn it over to Luana and then come back towards the end before we have questions. So if that's okay with you, Luana, shall I dive right in then?
Yes, absolutely.
Okay. All right. So let me share my screen so I can just put a couple things up here for you all. And is everybody seeing that? Okay, great. So first of all, let me just start with a word about what we knew about mental health conditions before the pandemic struck. So I want you to go back, way back in your mind to before March of this year. And back then, we already knew that we were facing a dire mental health challenge in this country. We knew that, for example, let me just advance here, that mental health conditions and psychiatric disorders are extraordinarily common. They affect more than 1 in 4 people in this country every year. And over a lifetime, more than 50% of us will be affected with conditions like depression and anxiety and post-traumatic stress disorder and many others. And in recent years, we have seen a continual increase in rates of depression and anxiety and substance use disorders in particular. Suicide has increased by 35% in just the last 2 decades. It is the second leading cause of death among young people. In 2017, there were more than 70,000 deaths from drug overdose in this country, and most people with these conditions, mental health conditions and substance use, do not get treatment. Perhaps related to that, on the right-hand side, you see that psychiatric disorders and other brain disorders are the leading cause of disability in this country. They outstrip heart disease and cancer even. So this is extraordinary. We also knew that there were disparities. While the frequency of mental health conditions is not dramatically different across, for example, racial and ethnic communities, there are some notable disparities. So Black African-American individuals in this country are more likely to report serious psychological distress or have higher rates of PTSD, but sadly more likely to be underinsured and less likely to receive treatment. In the Hispanic and Latinx communities, lower rates documented of disorders overall, but higher rates of suicide attempts among youth. And similarly, in the Asian American community, higher rates of youth suicide have been reported. In the Native American communities, higher rates of serious distress and PTSD and substance abuse has been a real problem. And in the LGBTQ plus community, higher rates of mental health conditions overall compared to straight people who self-identify as straight, 4-fold higher rates of suicide attempts and self-harm, and a good deal of sense of discrimination as many of these communities have felt in receiving care. And unfortunately, all of these groups are underrepresented among the healthcare providers who people would turn to seek care, and that itself has been a barrier. So that is the backdrop against which this pandemic hit. And you can imagine that in some ways what we faced with the COVID-19 pandemic is kind of a perfect storm of things that might make things even worse. So we have the trauma from people affected with the disease, with the disease itself, their loved ones and relatives affected with loss and death, unprecedented social disconnection from our need to physically distance. And as we'll probably talk about a couple of times today, social connection is one of the best established buffering factors in helping our mental health. Tremendous adversity as a result of the economic impact of this, unemployment, housing and food insecurity, loss of community and access to community and caregivers, including our religious communities. People are grieving losses without the benefit of their family or their communities with them. And this is really raised for many of us a worry that we're about to see, and maybe are beginning to see, a second pandemic of mental health impact, which may be in many ways as devastating as the infection pandemic. Particularly, there are a number of groups that are at high risk. Those, of course, directly affected by the illness with the infection and their families and loved ones. The healthcare providers and first responders who are dealing with just extraordinary, unrelenting stress and the need for vigilance. At every turn, people probably have heard about the emergency room physician in New York who died by suicide last month, I guess, who was caring for patients under extremely stressful situations and leading care. And we're beginning to hear stories like that increasingly. Folks with pre-existing mental health conditions who already may have anxiety or depression or PTSD and who are now facing these challenges, and underserved communities and essentially all of us facing the impact of this. And so it's a pretty extraordinary thing to be dealing with. Now we know that the impact of this pandemic is not evenly distributed, and the burden being borne is not evenly distributed. So early on, relatively speaking, in April, data from New York were already showing that Blacks and Hispanic Latinx communities were hospitalized at a higher rate, were getting the infection at a higher rate, were hospitalized at a higher rate, and were dying at a higher rate. And an analysis just released this month showed that compared to whites, Blacks had about a 3.5-fold increased frequency of death from the disease. In Massachusetts, not quite as high, but still very significantly higher. Latinx communities, again, about a 2-fold maybe increased risk, and even higher in our community. We know that certain communities here have been particularly devastated. So we're beginning to see now the unfolding of some of the mental health impact. 56% of people in a recent survey of Americans said that the pandemic was negatively impacting their mental health. We've seen reports of rising rates of substance use and domestic violence as people are, sheltering and isolating in their homes. And just recently, a Census Bureau survey looked at how many people were reporting depressed mood over, say, the last week compared to what we were used to a few years ago when people asked this question, and it was twice as much. So we're clearly seeing the beginnings of this. Now, this all happens against, for communities of color, a burden that is already known and has been a long-standing one and ongoing, and that is the mental health impact of racism. There is a substantial body of evidence demonstrating that exposure to racism and discrimination takes a clear toll on mind and body. The chronic stress and the physical tolls of stress, and Dr. Marques will talk more about how stress affects the body, but also documented higher rates of mental health conditions like anxiety and depression and PTSD. And even more to the point, today, evidence documenting what I think we probably knew, and that is that police killings of unarmed Black Americans have a demonstrable negative effect on mental health in the Black community. And this study estimated that at a population level, these killings might cause 55 million excess poor mental health days per year among Black Americans in the United States. So before I get to that, I'll just say this is what we are facing now. This is an extraordinary time. We are all experiencing unprecedented stress, I think, but responding in different ways. And the question is, what can we do? And this, I think, is the burning question for many of us here gathered here today. What I want to do now is turn it over to Dr. Marques to talk a little bit about the nature of stress and how we cope with stress and how we can enhance resilience. And I'll come back after that. So let me turn it over to you. I think you could probably just get the screen, Luana.
Yes, I can. Thank you, Jordan. Thank you, everybody, for having me here today. It's really an honor and a pleasure to be here with you. So I want to start by sort of sharing what I think it's all of us experiencing here, which is it's really okay not to be okay. And I want to talk a little bit about why it is that's okay for us to be having some pretty strong emotions right now. And then I'll answer some of your questions. What can we do in this moment to help ourselves? The world as we knew it has changed significantly, and it has not changed proportionally. As Jordan beautifully illustrated, our diverse communities, our individuals like myself who grew up poor in Brazil, understand this actually even at a personal level. It's really some of the things that are the solutions to decrease the spread of luxury. And many of our communities do not have the privilege of social distancing. They don't have the privilege of a home. And in addition to COVID-19, there are significant additional threats: food, shelter, work, racism. Those threats were there before. And I think what this pandemic has done is really widen the cracks in our system and really illustrate the need for us to really think about how to address our diverse populations and how to change our structures significantly. All of those threats, what it does, it activates our body. We are evolutionarily all wired to get out of danger. And so in the face of a real threat, and in this case, several real threats, our emotional part of our brain, our limbic system, our fight and flight part of our brain activates. And many of us have probably felt this early on with this fear of what will just happen. And what our body does is it gets ready to run from that threat. Our heart pounds a little faster, we get tense, we are ready to fight, flight, or freeze. And this experience is biologically wired and adaptive. So if anxiety is actually adaptive, when does it become too much? The way I think about this, and actually several of you asked, when is it too much? Let's talk about sort of the function of anxiety here. In the lower end here on the Yates-Dobson, what we know is very little anxiety or arousal actually leads to low performance. Think about this. If you drink coffee in the morning, think about this like when you wake up and you sort of feel a little sluggish and you drink that cup of coffee and you're going to have a lot more arousal. Right? This is when we get into that idea that arousal and anxiety can get us to the zone, to an optimal level of performance. Often people describe this when they are just in this flow state and their brain's just working for them. However, as this pandemic has gone from acute to chronic, the majority of Americans are reporting significant chronic stress. And when we are under chronic stress for long periods of time, our body responds and we start to get ourselves here on the right side of this curve, where stress and anxiety starts to really impair our performance across all domains of our lives. So how do you know if you tipped past that zone, and how do you get yourself back? Well, when I think about tipping off, I think about 3 domains, and this is really based on the idea that what we say to ourselves, our thoughts, affect our emotions, and that affects what we do. Many of us may have found ourselves stuck with really sort of black and white thinking. I'll never be able to support my family again. There's nothing I can do. And that makes a lot of sense. Our brains are spinning in response to this real threat. So the first thing that you can notice to give you an indicator that you might be off the zone and that anxiety might be too much is to watch what you're saying to yourself. In response to those thoughts, often you might have emotions like feeling really tense, tireless, hopeless. And I'm hearing a lot of that from my colleagues, my patients, folks that I talk to. That's like, once in a while, I just hit this whoa, and there's this rush of emotion. And then it will affect what we do. Several of us may have moments that you wake up in the morning and you just don't want to get out of bed. Or you're sort of feeling like, how do I get out of here? So what can I do? Now that we understand that anxiety is biologically adaptive up to a point, when we tip off that point, it really affects all what we do. And in 3 domains in particular, our thoughts, our emotions, and our behaviors. What can we do? Well, if what is driving some of the anxiety is this limbic, this emotional response, we want to work together to actually turn on a different part of our brain, our thinking brain, our prefrontal cortex, which in turn actually helps us to cool off our brain. So I want to share with you very brief strategies based on something called cognitive behavioral therapy. And I'm not here to teach you therapy, but I wanted to really anchor on the idea that CBT is evidence-based, science-driven, and highly effective. And the reason I chose the skills today is because we know that the CBT skills I'm going to share with you also have been shown to boost your immune system. And so I want to be able to cool off our brain, but also to see if we can boost our immune system during the stressful times. Here are the strategies that I think are important to cool off our brain. And I'll take one at a time to give you some very practical tips that you can use and share with others. Let's start with the idea of unplugging and anchoring. So what do I mean by unplugging? Well, research tells us that after the marathon bombings, individuals that watched 6 or more hours of news had actually more arousal and stress than those that were there. So being plugged to the news and consuming that information on and on again is activating our emotional brain. So we want to cool it off. So we want to really unplug from the news. And how do we do this? Well, one suggestion I'd have is you could go back to how you consume news before March. Were you the kind of person that got home at night and watched a little bit of news? And if so, maybe trying to anchor on what you did before. But the other idea is if you really still watch a lot of news before and now you're noticing that's activating your brain, perhaps following the WHO's guidelines of watching the news once or twice a day, to really trying to limit it. For me, my thermometer is if I start to feel some of those emotional sensations in my body, I start to tense out when I'm watching the news, it's time to really unplug. But your brain might really be still spinning, and that's why I think it's important to try to anchor. Now, what do I mean by anchor? Trying to do something that you know that can actually help slow down your brain. For me, a walk around the block helps, a cup of tea helps, trying to sort of even being able to rest for a little bit. What we're trying to do here is really give your brain a little bit of a break so that it can really get back to the zone. Let's shift gear a little bit and talking about charging up. Our bodies, our physical bodies, are very similar to the batteries of our car, that we need to actually drive our cars to recharge. This is actually quite challenging at times when we feel that sense of paralysis, when you feel like the world is too much, and usually we want to just sort of like shut down. But the reality is we need to be able to keep moving. And by this, I don't mean exercise. What I mean is trying to sort of make sure that you're getting up a little bit, that you're going for a walk, that you're taking a moment to play with your kids. Any kind of physical activity will keep you going and actually will give you more energy. I can share with you that I've had moments after during this pandemic that I'm working a lot. I get to a Saturday and I want to do nothing. But I just start to organize things a little bit, and within half an hour, I'm feeling slightly better. So it's counterintuitive, but we have to spend energy to get energy. Let's shift a little bit and talk about facing reality. And here, I don't mean the reality of the world out there. I mean the reality in our brains. All of us are sitting with a lot of uncertainty. And as information is coming through us, it's hard to understand and separate things. Uncertainty is something that's really challenging for our brains because our brains keep trying to figure out, how do I get certainty here? And the reality is, in some way or another, most of us are right now in a sense that the only certainty we have is a bunch of uncertainty. So how do we do this? How do we face this uncertainty? Well, I like to think about how can I what are the things that I can actually control, right? You can control charging up. You can control watching less news. You can control managing a schedule and trying to do something that's more manageable for your brain instead of doing things back to back to back. But to face the reality of the world right now, the only thing that brings me some sense of comfort is to understand that we're all going to be comfortably uncomfortable. That it's very challenging times, especially for a diverse community. As a Latina woman, it's something that I feel day in and day out. And so it's really sort of settling with the idea that we need to take care of our bodies and our brains, but I don't want to minimize that's still going to be discomfort. Staying connected, as Jordan talked about, it's one of the things that we know buffers depression and anxiety. And research shows that actually connection through Facebook can actually increase life satisfaction and decrease depression. And we've seen already many creative ways of staying connected. And I've been hearing some really amazing things. For example, the city of Chelsea is going to give job to 200 high school students. They're equipping them with laptops and Wi-Fi so they can connect with elder individuals in the neighborhood so that they can have support. Staying connected really is a way to sort of ensuring that we're on this together. And in that example, actually also being of service. And that's the last thing I want to remind us of, is that being of service to others can really help us decrease depression and happiness. And I'm sure many of you here have been on service often, on and on and on. And so I really want to thank you for all you've done, and our heroes out there. They're really ensuring that all of us can stay safe. And there's many ways to be of service. Early in the pandemic, one of those things that we didn't even know what to do. How can I help others without putting perhaps my family at harm? And here there's a website that you can actually sign up for virtual opportunities to be of service. And the example I shared with you that the city of Chelsea is doing for the high school students, it's incredible because they're focusing on staying connected and being of service, which can really allow their brains to cool off. I want to end by reminding us that it's tough. We're all comfortably uncomfortable, most of the time actually quite uncomfortable. But research shows us that we can be resilient, that at least 50% of people that go through very difficult things bounce back, and that opportunities like this today, and this lunch and learn, coming together and sharing stories, that builds our resilience, allows us to really stay ahead of it. Many of you asked about additional resources. Jordan actually is going to share some amazing resources from Mass General Hospital, from a website that he and his group created. That's incredible. But I have a few resources. If you go on my website, drluana.com, we have some webinars that we created. We're releasing a course that's going to be designed for mental health for all. We're trying to make that available in several languages. That will be coming out early July. And there are also some global resources there. So before I end, I just want to thank all my team at Mass General who put together these beautiful slides for you. They really wanted to be here with you, and they share the mission of addressing our communities and bringing skills. I will stop here and pass it on back to Jordan. Thank you, everybody.
Thank you, Luana. That was incredible. So let me go back to just picking up a little bit on what you started to say about the resources, and thank you for sharing that. And I'm just going to add, as you mentioned, a couple of things. One of them is this website that we developed at Mass General, which is available to all. I want to particularly thank Dr. Carmel Choi, who really led this effort in many ways. And this is in some ways, a one-stop shop for kind of vetted and curated resources of various kinds. And we have done translations into Spanish. We're updating it relatively continually. And I actually just want to see if I can share. I'm going to go out to the website just so you see what this looks like. Can you see that now? Okay. So when you go to the website, you land here. There's a little introduction to how you use the guide. And what you'll see is that we've provided materials grouped under a number of different topics: general mental health and coping, things that are relevant when there are folks with specific mental health conditions, families and children, our frontline responders, military families and veterans, mindfulness, and other tools. This has really been a collaboration among many people in the community to put this together. And I'll just show you, if you click on, for example, families and children, it brings you to that page. And what we've tried to do is, in a number of domains, actually pull out what are some of the most important messages, but also provided links to the primary sources themselves. So for example, here's something about how to talk to kids about the pandemic, things about how to talk about the coronavirus to children, there are videos and so on. And I'll just go back out now and look at the another example, the mindfulness and other tools page, which brings you to resources that include freely available videos, apps, things that cover mental health, maintaining healthy habits, mindfulness, even staying active, which we know, as Luana mentioned, is a particularly helpful thing for our mental health. So I encourage you to just take a look at it, and certainly also if you have feedback about it, we'd love to hear it. As I said, we're improving on this, we think, regularly. So that's one thing to know about. And again, we'll give you these links at the end. Let me go back to where I was. And you're seeing my slides again, I believe, right? Okay. So another thing is other resources, connecting with trusted sources in your community that you already know about, perhaps faith-based and other community organizations. I mentioned the Corey Johnson program that many people may be aware of through the Roxbury Presbyterian Church for traumatic healing that has programming relevant to the communities of color in particular. Healthcare provider and community health centers, your community health center or provider. There's been a notable transition to telehealth, which is in some ways a wonderful development. It has, because people were not coming into the hospital or doing face-to-face visits for a while, there was this massive transformation of the system to enable people to be seen or speak on the phone remotely. And in fact, at Mass General, we've gone from 5% of visits that way to 97% of visits that way during this period. Here's a list, and again, you'll get some of these just to take away with you, but some very helpful resources in times of crisis. 24/7 free confidential access to the new National Suicide Prevention Lifeline and the crisis text line, which also connects you if you don't either have access or want to do by phone or by video. And also a couple of other organizations to be aware of. The National Alliance on Mental Illness, which has phenomenal materials and also support for families struggling with lived experience with mental illness. The Anxiety and Depression Association of America, which I'll parenthetically mention Dr. Marques is the president of, also a really important resource. So that's what we can do now. Let's talk for a minute about how do we make things better for the future. I just want to end there and say a couple things. I want to emphasize a couple of things. One of them is we have to change and address what we call the social determinants that we know are the underlying sources of a lot of health disparities and distress, and that are worsened now. That means economic inequality, housing and food insecurity, making sure people are preserving their jobs through this time, improving access to care, and overcoming structural racism and discrimination. And in many ways, ironically, the most powerful and effective help we can give people or interventions we can do are not necessarily sitting face-to-face with a provider, but changing the circumstances that give rise to stress. The second thing I would just want to say a word about is research, is getting answers to questions that we don't have answers to. We need to know more. Why are there are these disparities? What causes mental health conditions, and how do we best match interventions to those who need them? And I'll just mention that there has been a long-standing gap in diversity and inclusion in biomedical research. One example, just from the field that I do a lot of research in, which is genetics, is pretty astounding. In 2009, about a decade ago, 96% of these genetic studies that we now are seeing revealing lots of interesting information were restricted to individuals, only included individuals of white European ancestry. A decade later, it's not that much better, still more than 80%. And we know that genetics and these other kinds of advances are bringing the next wave of healthcare. We need to make sure that no one is left behind. And in that context, I just want to mention that, in 2015, in his State of the Union address, President Obama laid out a call to action for a transformative way to approach how we learn about medicine and to begin something in the realm of precision medicine, a precision medicine initiative. And that led to the All of Us program, which you heard about at the beginning. And this is, as Leverett mentioned, a historic, it's the largest, most diverse research study of its kind ever, gathering data from 1 million or more people living in the United States to accelerate research and improve health by taking into account the individual differences that make each of us unique, not a one-size-fits-all kind of approach. And so this is not only a large study, but what is notable about it is its deep commitment to diversity and inclusion, making sure that no one or community is not at the table and is potentially left behind from the advances that we hope will emerge. So it has taken a transformational approach to diversity, making sure that communities that have been historically underrepresented in biomedical research are not underrepresented here. And I'll just mention that, as Leverett mentioned, the All of Us New England part of this is this wonderful collaboration between Partners Healthcare and its affiliated health centers and hospitals, and Boston Medical Center and its affiliated health centers as well. And I recommend that you take a look at it if you are interested. The program nationally launched 2 years ago and has already enrolled 350,000 or more participants, and has delivered on this promise of making sure that those underrepresented in research are a part of this. So more than 80% of participants are from groups that have been underrepresented, more than 50% from racial and ethnic minorities. And the, relevant to what we're talking about today, the program has just recently launched a major initiative to better understand and gather information about mental health and social determinants of health and the impact of the pandemic on that in the form of what we call the COPE survey. So if you're interested, take a look. I would encourage you to check it out. I'm going to stop there. I know we have so many questions. Hopefully we addressed a bunch during the course of this, but I want to turn it back over to Leverett and see if we could start taking some questions. Are you there, Leverett?
Okay, now I couldn't unmute myself because the host had muted me. So now I am. Thank you. That was incredible. Thank you so much for that insightful, frank, stark data, especially. And we're so grateful that you made the time to join us. I'm excited because we have about 15-20 minutes for questions, and I know that we've had a number that have been submitted. I'll get to one that you touched upon a little bit just now. You talked about the long-standing gap in data for underserved communities. Is there where can we find this? Is there any data? As an Asian American, clearly I am interested in data and Asian American mental health. I know that it's been something that's been severely underreported and sometimes pushed aside in the Asian American community. Where can we find data for the Asian American community, Black, Latino community? I mean, there's so many stressors on all of our communities. What can we do to increase the representation, the data representation of all these communities? I know the All of Us program is one of them, but are there other avenues that we can pursue to do this?
Yeah, thanks for that question, and I'll also ask Luana to respond. In terms of the data on what the mental health disparities are, there's a whole body of research, more accessible. And in fact, where I got some of the numbers that I showed you was through Mental Health America, which is a easily accessible, for example, on the web, has a whole page on mental health disparities in different communities with numbers and figures. That might be a place to start. The National Institutes of Health and the CDC also have data that are accessible. But we can also, if people are interested, try to pull together some things and share it with this group. In terms of changing that scenario, I think you're absolutely right. It becomes a social justice issue that people are not represented. And part of it is the understandable reticence that people sometimes have, particularly in communities that have been marginalized, about participating in research there have been, frankly, abuses in the past, and people are still wary of those things. And so, you know, but the reality is that research projects like this need the participation of everybody to be at the table. All of us, as you said, is one really, I think, good example of that. But finding out about and getting involved in research opportunities of various kinds through, for example, the health centers that we were just talking about, which are continually seeking volunteers to participate. I know this is an area of interest for Luana, so let me turn it over to her to comment as well.
Absolutely. I think historically, as Jordan said, there's a divide, and researchers went into communities to research communities. And I think that's very much still alive for some folks. And so the way I think about it is it's a two-way street, right? So I do all of my work in the research and of our training institute in diverse communities. I'm committed to it personally. And I think it has to be the idea of collaborative-based participatory research, that we sit at the table together and we first listen, right? And that we hear what the community actually needs, not what we think we can provide. And so I think it actually starts with the researchers. I think the barrier has to be addressed first, so the researchers, sort of really an open-minded idea, so that we are partnered. And then once that partnership develops, that there is a sort of it's hard to trust different groups. And so really making sure that you're leveraging both of your strengths. And so for me, that has been really the win, is when I get to sit with our community. We did a project with young men coming out of jail. And I showed up and listened and then put something together. They looked at me and said, yeah, that's not going to work. And then I said, okay, so that's not going to work, so let's fix it. And so I think that's how we get there. That number that Jordan showed, it's just awful. And I think our communities of color are right to have had reticence, but you can't get your voice heard unless you're at the table. And that's why I force myself to sit at the table. And I would urge all of you here, there's 120 of us here, to sit at the table and really bridge that gap between science and practice. It needs to be done. Research is one way to do it.
Great. No, thanks very much. That's a great answer. Kind of building off of that, when you went in and they looked and said, yeah, that's not going to work. I guess the question I would have is the CBT strategies. Have those been tested? Have those been proven effective in underserved communities? What type of research has been done there?
So cognitive behavior therapy, broadly speaking, right? It's the idea of really getting our thinking to look different and our behavior. It has been done, adjusted to all sorts of communities. One of our study was with MJH Chelsea, and we took the classic white manual and adjusted to MJH Chelsea for the providers and the patients. We did it in English and Spanish. We stripped all of the, with all due respect, very American theoretical thinking. I can't follow it either, and we made it very simple. And it's done in every different kind of ethnic group. I think the problem is not it doesn't exist. The problem is the excess, right? We don't have enough providers. They're trained to deliver in a culturally sensitive way. So it exists. It's just getting into our communities. That's why we are here developing a training institute to train non-licensed professionals on very culturally sensitivity as skills, not therapy. Right? If you think about this as building blocks that all of us can use, then we need to get them rolled out in our communities. We know it works, and we know it works in diverse communities. We just need to get it there.
Great. No, thank you. Thanks. Dr. Smoller, do you want to add anything on that? Or?
No, I think that was perfectly said.
Thank you. I know we have a lot of younger folks on the Zoom today, and so I wanted to address that a concern that as a father as well I have is, how about all these stressors on younger folks, either students who are homeschooling or learning from home, college students who are about to try to head back onto campus, and if they can't get back onto campus, they have to school remotely. How and you know, not just the being at home portion of it, but just sort of the everyday stress of a person of color going out, are you know, and some of the racism, the institutional racism, law enforcement. You're worried about being seen as such and such. How do young folks handle this type of stress? Because I mean, it's hard enough as an adult. I can't imagine what it's like to be a young person.
Well, I mean, I'll say that, first of all, we are, you hear this all the time, but we are living in an unprecedented time. I mean, no, we don't have any experience with society kind of shutting down and not having school active at all, and people being home all the time or almost all the time together. So I think everybody is learning a lot as we go. There are some principles I think we know, and it depends on uh, the age of the young person we're talking about. For kids who are younger, not teenagers, but younger, there are a number of things. And again, I would, in the interest of time, I would point people to go to the website because there's a lot of material there. But one of the important things is that people know that the people that they rely on are kind of okay. Not that you hide the fact that this is a stressful and difficult situation and that we're all struggling, but they, it's that concept that we often hear of, putting your oxygen mask on first, making sure that you're okay and that you can be in shape to be reassuring and there for your kids. The disconnection that we feel is even, in the schooling thing, is worsened in a way by the digital divide that many people are experiencing. That is that for some communities, it's easier to stay connected to school than for others. It depends in part on Wi-Fi bandwidth and availability of things. In general, I think, especially younger kids value the structure of having routines and feeling safe and having routines often, and finding ways to socially connect. When you're talking about older young people who again are facing unprecedented challenges in terms of, we're coming up in graduation season, or it's already sort of happened, all these things that are not happening. And particularly for communities of color in the environment, as we talked about before, where these stresses are happening. I think the community supports and social connection and people keeping connected to their trusted sources of support is a really important thing. Acknowledging, as Luana did, that it's okay to not be okay, and we are in fact all learning how to cope with this on a daily basis. So let me ask Luana to comment.
Yeah, I mean, I guess also, if I could, especially the younger folks, like for example, Asian American youth have been the targets of
Right.
of violence ever since COVID-19 hit, and now add on the stressors to Black and Latinos, with the fear of police and law enforcement. So there are all these external stressors. So.
Yeah, I agree with Jordan. I think, I see a comment here. There's microaggressions, there's full-on aggression, and our brain is on fight or flight trying to figure out what to do. We don't have a book for this one, right? We're flying this plane and building as we go. And I think, there's an intersection between grief of the loss of life as it was, and the milestones of real trauma and then real racism. And I think Jordan's right. We need to sort of normalize the best that we can to our kids. I think parents have to take care of themselves so they can be there for their kids. And then for teenagers, we need to listen. We need to understand what it is, the narrative they have, knowing that it's going to be it's difficult.
Okay. I think we have time for one, maybe two more questions, depending on the question. And just as a reminder, anybody who missed slides or any part of the presentation, we are going to be providing those. They're going to be up on the Commonwealth Seminar website. They're going to be up on the All of Us website. So anybody who missed that, please check back in a couple of days, and we'll have those up. One of the next questions is, what existing government, private, or nonprofit sector responses to COVID-19 or things that have happened afterwards related to mental health are missing, and what can be strengthened, and what can we do as communities to help strengthen those?
Wow, that's a big and important question.
How do you solve world peace, essentially?
Yeah. Okay. All right. Now that you kind of brought it down to that, I think I can address it. I think that one of the things that is an enduring problem is access to care. And that is probably the most, apart from all the social determinants of health, which are policy and structural issues that need to be addressed. But a maybe more tractable one in theory is access to care, improving access to care. I mean, Luana actually is an expert in this and in the dissemination of care opportunities. And I'm going to turn it over to her for a second, or in a second. But the policies have to be adapted. And we're seeing a little bit of this in the move to telehealth, in the relaxation of requirements for prescription of medication or for accessing providers. But, under insurance, the lack of culturally sensitive and representative minorities in mental health care provider settings, those are some just really urgent needs that need to, and that could be addressed. Luana, do you want to pick up on that?
Yeah, I mean, you did it beautifully. We just published a commentary on flattening the mental health curve need after the pandemic. Access to care was one. Before the pandemic, 20% of US population needed care and 0.1% was trained to deliver. There's no way we're going to widen that Grand Canyon with the way we have. So we have to reimagine workforce is how I think about it, and think about how we can provide skills, not therapy. And it's at every level. I think policy is where it needs to start so that we can actually change some of the things. So I think, Jordan, I'm with you 100%.
And I think we can try one more question. We have a couple of minutes. I know, Dr. Smoller, you have to hop off right at 1, and so does Dr. Marques, I believe. So you had mentioned staying connected is one way we can all feel better, and one way we can strengthen ourselves. How do we do that now? I mean, it is so difficult with COVID-19. It's how do we keep it also kind of cross community? How do we support each other? Because everybody's talking about Asian American community, African American, Black community, Latino community, as if they're in silos, but a lot of times they're all interrelated. So how do we connect? How do we keep our communities open? How do we engage and support each other? How do we be of service to each other?
Yeah. Quick thoughts are, I've just been amazed and impressed at how creative people have been in finding ways to stay connected, whether it's digitally, which is a big new thing, or through the phone or texting or other things where people come together in ways they haven't before. And for many of us, that's not as good as being connected, but in some ways it has this opportunity, like we're seeing today, 100 and whatever people were able to come together at lunch. And so having those opportunities, creating those opportunities, I think many of our community organizations are coming up with these kinds of things that can keep us together and stay connected digitally. So it is this is the moment of grassroots, I think, when so much is being invented to adapt to a situation and coming from the grassroots. Luana, what do you want to say?
No, I think you're right. I think we're inventing and going, and I think I'm also with you. It's impressive how fast we adjusted, and it shows that resilience.
Yeah.
Thank you both so much. Thank you, everybody. I mean, thank you, Dr. Smoller. Thank you, Dr. Marques, for your time. We know how incredibly busy you are, so thank you for your generosity. Thank you for your wisdom. That was wonderful. Thank you again to Cheryl and Elizabeth for their work in putting this all together. We couldn't have done it without you. And thank you to all of you who have attended. 125, 135 people signed up, and we, in the middle of a Friday and a nice Friday at that. Thank you all so much for your interest and your passion and your questions. Again, we hope that this is the first of many collaborations with the All of Us program and Boston Medical Center and partners. And again, if you'd like to, we'll keep it open for a little bit. If you'd like to share your contact information in the chat, this is how we network nowadays in terms of socially distancing. So we'll keep it open for a little while. If you have any questions from me personally, send them my way privately. And again, check out the Commonwealth Seminars website and the All of Us website for anything you may have missed today. So thank you all so much. We have a wonderful weekend. Stay safe, and we hope to see you all again soon. Take care.
Thank you. Take care, everybody.
Thanks so much.